Hello, my name is Dr. Vipra Sharma. I'm a hematologist-oncologist with Hartford Healthcare Cancer Institute. So hematology-oncology includes both benign hematology, which could be like iron deficiency or clotting disorders. It also includes malignant hematology, which would be like lymphomas, leukemias, and I also see patients who have solid cancers such as lung cancer, breast cancer, colon cancer. My parents always instilled the idea of working with others, helping others. And then as I was growing up in middle school and high school, I always had a tendency to enjoy sciences. And medicine was just that perfect blend for me. I get to care for patients and foster relationships with them and their family, which I think is very important in oncology. I don't want people to feel like they're just a diagnosis. They're an individual person and they matter to their family. And I feel that they matter to me as my patient. And I take their health very seriously. I participate in disease management teams where we discuss, not only clinical trials, quality of care, and just to make sure patients are getting the standard of care that they deserve. Like we have multidisciplinary tumor boards, and we'll have a patient presented. I had one this morning where the surgeon will discuss the case, and then we'll talk about what the radiation oncologist can offer, what the medical oncologist can offer. It's kind of like getting a second, third, fourth opinion in one room without having to travel anywhere. Oncology is changing very quickly, right? And at the forefront is clinical trials. Clinical trials are giving patients access to forefront upcoming therapies. This is how us as oncologists are trying to get more effective treatments for the patient, but at the same time not compromising their quality of life and their well-being. For patients, that means better outcomes. So outside of medicine, I'm a mom, I'm a friend, I'm a daughter, I'm a wife. Family is so important at any time in your life, and I think that's why when patients are going through the diagnosis of cancer and treatments, I try to get family and friends involved at the patient's wishes, because I know it's so important to me, family and friends. I can only imagine it's important to my patients too. What I would tell a referring physician about myself is that I see the patient in front of me, not just as an individual, not just as another patient or another diagnosis. I try to build relationships which are fostered and built on, empathy, open communication, accessibility, and education. I want patients to be involved in their care. I want their patients to understand their options.